Rachel Maddow, does the president bear some responsibility? Does he undermine his credibility when he makes some claims like, if you like your insurance, you can keep your insurance, when a lot of people have said, not really. Employers could drop people from insurance if they wanted to move people into a public plan, if that existed. It may be an aspiration, but he can't guarantee it.
It's the way what he has suggested would guarantee it. What's happening, and I think where the president has some more responsibility, is to give the Congress more direction. I find it strange that the American people have decided that there will be a lot more Democrats in Congress than Republicans. The Democrats have a huge 60-seat majority in the Senate, and therefore they've got big majorities on every committee, too. But Max Baucus, who is a Democratic senator, has decided on the Senate Finance Committee, which has this key role in what's going to happen next, that they won't have the whole committee do it. It'll just be 3 Democrats and 3 Republicans who are going to make that decision. One of those Republicans is going around the country giving out copies of Glenn Beck's book and saying that health care reform will pull the plug on Grandma, Senator Grassley. So for the Democrats in Congress to be essentially giving up their majority, deciding the way this is going to pass, I think is something that the president ought to weigh in on. There's a reason that Democrats have a 60-seat majority. The American people voted for it, and I think they'd like a Democratic bill.
Congressman Armey Dan Balls wrote this in the Washington Post on Saturday about the political tactics involved here. He wrote, the president and his team are receiving lots of advice from allies frustrated that the White House has not been more aggressive in firing back at reform critics and in attacking a strategy they believe is designed to bring down Obama's presidency. Do you think that's what conservative opponents of his health care reform have in their gun sights right now?
Absolutely not. I mean, this is probably the most, certainly the largest hostile government takeover in the history of the country, 1/6 of the entire economy, and it's the most intimate. I mean, you have people on the streets today, real people, that are saying, am I going to, in fact, end up with a decision regarding how my liver infection is going to be treated in the hands of somebody in a bureaucracy with a degree in sociology? And it is, if you read this bill, which is a frightening thing, by the way, I was reading it again yesterday, it is unnerving to read this bill because of the growth of bureaucracy and the idea that, and I'll give you an example. I got a contact the other day, a fellow got in touch with me. He has been on Social Security disability for about 7 years, and all of a sudden, out of the blue, he receives a letter saying, we're taking you off of disability and you need to send us $21,000. You don't have $21,000. And he can't even figure out who made that decision. He calls his congressman says, I don't know what I can do about that. He tries to call his senator. He can't get a call through. So he calls me, for crying out loud. And this guy doesn't even live in Texas.
Senator Daschle, a hostile takeover.
That argument suggests that Dick obviously enjoys the status quo. The status quo eliminates 50 million people from insurance today, 12 million because they are discriminated against because they have disabilities. 18,000 people last year died because they didn't have insurance. That's the status quo. And rather than have government do it, apparently Dick would rather have the insurance companies do it because that's who's doing it now. Jon Stewart and others call it the American lottery. You send in your forms and you hope you get something back from the insurance companies. That, to me, is why the American people want to see change. They want to see change because of the costs. They want to see change because they understand the quality is going down in this country. And they want to see change because so many people aren't covered.
Let me dispute the question on quality. There is no indicator anywhere in this country that the quality of medicine is declining. There's that is absolutely true.
What are we ranking in life expectancy in this country?
Life expectancy is not an indicator when you have a society that's built our way.
It's not an indicator?
Let me finish, Tom. We talk about neonatal mortality. Where's the neonatal mortality? It's not in the private insurance plans. It's in Medicaid. Well, here's the government-run program that is failing us in terms of neonatal mortality, and yet we use as an indicator neonatal mortality and say we need more government rather than less. The question is, let me finish. The very fact that the president would suggest that doctors take tonsils out to make money rather than because it's an indicated procedure is ludicrous. Most people who get a referral to an ENT have already had one opinion that they're worried.
This is totally
quick comment, and I'm going to get a break.
Commonwealth listed us as 19th out of 19 industrialized countries. We rank 19th overall. World Health Organization listed us 37th, just below Costa Rica and above Slovenia. I mean, you can rationalize all you want. The fact is, the quality in this country. We have islands of excellence, but we have a sea of mediocrity, and we've got to address it.
Let me get